They collected 500 mils of very bloody pelvic fluid, then sat on it for 3 days before sending it to an outsourced lab. Top of the notch cancer center, and they send it, like they did here in Melbourne, to a dodgy lab. That fluid degraded malignant cells, likely lysed, but instead of admitting compromised results, they backdated entries, used trainees, baby doctors to sign off because their names mean nothing in court, and marked the report, edited result, final. You don't need 178 pages that they tried to overwhelm me with quadrupled bogus reports. Just thinking I'd just exhaust myself and not understand what they're trying to do. But you don't need a degree to work out that all they're doing is burying the evidence, literally. So specimen collected the 6th of September at 8:49, same day collection. Lab received the 9th of September at 9:44. It's a 3-day delay with no valid justification. The report finalized on the 10th. That's 4 days after discharge, post-op. Final stamp given despite delay. Another result on the 6th of September, 9:25. That's earlier than received date, so that's impossible unless it's backdated. And then the edited result final, the 10th of September, 2024. This confirms post-processing interference. My telemetry strip from Laura Lambert shows a QRS so short that it fits inside half a box. That's 20 milliseconds, not the 108 that they stated. My chest CT from 2022 shows suspicious masses around the heart, vessels, and pleura. Rather than investigate, they lied, claiming my QRS was 108. That's not negligence, that's cover-up. What it means when you can't feel your heart anymore. I haven't been able to feel it for over a year when it's muffled or it's just not there at all. Pericardial or chest wall infiltration. Tumors, especially mucinous or lobular, infiltrating pericardium, the sac around the heart, the pleura, chest wall musculature or fat. This physically absorbs or muffles the vibration and pressure waves you would normally feel. You don't feel your heart beating, not because it isn't, but because the signal is blocked. And that's what it shows. The scan that they did where they've manually written, in 2024, they had to manually write it out because they're lying. Each box represents 0.04 milliseconds. And my blip, the QRS, is only in half a block. So if my QRS was 108 as they stated, that would be going across 2.5 blocks. Because mine fits in a half a box, which is 20 milliseconds. So they've increased that 500% and lied and said it was 108. Because if they told the truth, they'd have to explain what's muffling my heartbeat. And they would be forced then to run a full ECG, call cardiology, delay discharge, and check for pericardial fluid or tumor spread. So they fudged the numbers like they're doing everywhere else and hoped I wouldn't notice. What you're about to hear is a real recording. Dr. Laura Lambert with Charmaine Skillman. She was recorded at my request, explaining away the obvious signs of severe bladder dysfunction, bladder images that were visibly distended, distorted, and undeniably abnormal. But because she had already promised the full surgical procedure on video, she had to come up with something to cover herself. So she blamed my pelvic floor. I want you to listen closely to what she says. Listen for the stalling, the speculation, the way her language wavers. Words like maybe, might have, possibly, I don't know if technically. This isn't medicine. This is gaslighting. What you're hearing is a professional backpedaling in real time because the surgery revealed what she didn't want documented. And what I now believe is that this wasn't an oversight. It was a cover-up.
Yeah, so everything went very well. We did not find any obvious signs of the
cancer or the tumor or the lamina or anything like that. I recorded everything. This is just a nice look into the pelvis, and everything looks fine down here. There was a little bit of physiologic fluid, but it was not mucin. And we did do some washings as well. The other notable things are, I did the exam under anesthesia. I didn't see anything concerning her bladder. She might have some pelvic floor laxity, and her bladder might be either kind of prolapsing a little bit, or her urethra might be getting kinked a little bit. Her bladder just was very, very distended. It didn't look like she had voided before the surgery, or maybe she just can't empty, and she's retaining, and it kept getting bigger and bigger. This is all her bladder here. It just kept, so we straight capped her at the end, and got quite a bit of urine out. So hopefully decompress it, at least for now. So she doesn't go into retention again like she did.
Yeah, they gave her a cup for a urine sample, and I assume she left the room and came back. I assume she was able to get some urine out, but she does have trouble.
Yeah, she definitely.
Impulses.
So the urinary retention could definitely be causing a lot of the symptoms that she's having.
Like with pain.
Yeah, and the other thing that Dr. Bedell said was that if that is endometriosis, even a little tiny spot like that can actually cause a lot of discomfort. It's not based on the amount of endometriosis, it's just the inflammation that occurs from it.
So I don't know if technically it's that. She just gets extremely, extremely hot.
Mm-hmm.
And I wondered if it was some kind of a little bit of menopause.
It could definitely be. I mean, that would, checking hormones. You can check hormone levels and kind of get a sense of where somebody is in terms of menopause. That's another possibility.
Dr. Lambert claimed my bladder was just very, very distended. She said maybe I hadn't emptied it, that I was retaining urine, that maybe I had pelvic floor laxity or urethral kinking, that a straight catheter at the end drained a significant volume. Think about that, at the end of the surgery. But here's the truth. There was no urine in my bladder. What they were seeing, the reason my bladder looked so grossly distended on camera, was because it was filled with gas, not fluid. That gas was coming from fistulas, abnormal tunnels created by tumors that had penetrated through tissue and formed connections between the bladder and adjacent organs, like the bowel and uterus. This is a hallmark complication of aggressive infiltrative cancer, and gas cannot be drained with a catheter. So my bladder sat there, stretched and pressurized, dwarfing every other organ in the field. And Lambert had no explanation for it, because acknowledging the truth would have confirmed widespread advanced disease. It would have required biopsy, staging, and intervention. Instead, she offered flimsy, impossible excuses on camera while being recorded. Laura Lambert, if the system wasn't so corrupt, Charmaine Skillman, both of you are just evil. If this was a fair, just world, you both would burn. All of you deserve to burn.